I hope you guys enjoyed your lunch and want to go ahead and get things started. I'll let our speakers continue to eat while I introduce them. And thank you again for showing up. Thank you for being here. This is fun for me. These are 5 of my heroes. These are 5 of my good friends. These are 5 people I love dearly, and these are 5 people that I care about and are kind of my team in terms of my own personal recovery. And I'm real grateful that each of them, none of them looked at the email. None of them knew what they agreed to do. But they've all said, well, you asked me to come here, I'm here. What are we doing?
Still not sure.
So I'm real grateful they're here. And I'll just start here and start introducing them to you guys. Some of you may know them. Some of you may not know what they've accomplished and what they've done for the city of Nashville and Tennessee and recovery in general. And they truly are my heroes. Our theme is together. We are the change, and I think they really represent that together we are the change. I worked in this industry for 34 years, and one of my greatest joys is to go to other parts of the country and talk about how people in Nashville work together and how we're together, just as who we are, right? So that the flood that happened 11 years ago, we made national news for kind of coming together and taking care of Nashville. We just had a flood that affected our ranch facility. People came together, and we actually had to tell people not to come out and help, that really the city of Waverly was the issue. We lost some buildings, right? We didn't lose any lives, and it really is the heroics of Victoria's team that made the difference. But that's who Nashville is, and that's who the Nashville recovery community is. And that's who these guys represent. So Thomas Gooch is my good friend. Thomas is a lot of different things. He's the founder and CEO of My Father's House. My Father's House is a recovery program for men who are non-residential fathers who are coming out of the criminal justice system and want to be dads. That's what he does in his spare time. And his full-time job, he has really created outreach for active drug users here in the city of Nashville. Was with a well-known organization, Streetworks, for over a decade, and has really spearheaded. They were the only needle exchange program in the state, and they were doing it illegally, and the state didn't care, right? The state was real happy to have them. That's now, and helped through his advocacy work, the state now pays for needle exchange throughout the state. There are needle exchange programs throughout the state of Tennessee, based on his work. He was one of the first people to do Narcan distribution to active drug users in the city of Nashville. And there are literally thousands of people, because I've seen his report, who are alive because of the Narcan that they distributed long before it was popular, right? Long before anybody else was doing it. He's currently a research associate at Meharry Medical College and works at kind of getting that knowledge out. And real grateful that he's here. And thank you. Carrie Fraser is Reverend Carrie in the recovery world and has worked at almost every treatment center here in the city. She's currently at NRC, which is no longer NRC. I think it's BRC. And she told me she wasn't sure what BRC stood for. But
It's not true.
But she's married and buried more recovering people than anybody else in Nashville. And anybody who's been in treatment in Nashville has had a special Carrie moment. Where they really found their spirituality. And she speaks nationally around what is the core of 12-step recovery, which is that spiritual component. Trina Frierson needs no introduction. She is the CEO, founder of Mending Hearts. Mending Hearts is a women's program that started with a couple incarcerated women who are living in a recovery house and is now a 100 and odd bed full continuum of care. Trina works at breaking the stigma for women in recovery and incarcerated women. And on July 23rd, if you've seen all the pictures of One Finger Up, to remember that there are women that out there that need help and are worthy of it. Yep. Thank you. Stephen Loyd is has 17 different jobs. He's the medical director of a variety of treatment programs including Renewal House, which I just overheard a second ago. Cedar Tree, which is throughout the state, is his program. He is, again, one of my heroes. Has made tremendous strides in terms of decreasing the stigma for opiate users, decreasing the stigma for MAT. He was a former drug czar of the state of Tennessee, and his advocacy work really ensured that MAT, or MOUD, depending on your nomenclature, is really incorporated into what the continuum of care. And that the stigma that folks had because they were taking a medication is really much decreased because of his work. And importantly, MAT is delivered in an appropriate, meaningful way in the state of Tennessee because of his work. He's also a professor at McQuilkin Medical College in Eastern Tennessee. And I think I don't know what your role is there. He teaches doctors. Is that good? Anything else I left out?
Now that's important. We need him to know this.
Yeah, exactly. So exactly. And it's worked very hard at ensuring that physicians know who our people are and that they're appropriately treated. And he and I once argued over something that we probably agree about on the front page of the New York Times about 5 years ago. So he's one of my good friends. Another good friend of mine is Michael Cartwright. Michael Cartwright needs no introduction. He is the founder and CEO of Foundations Recovery Network. He's the founder and CEO of American Addiction Centers. He is the founder and CEO of about a dozen other companies. His advocacy work is why co-occurring disorders are part of the standard of care. That's his work. He worked with SAMHSA to ensure that co-occurring disorders, something we just assume is part of the deal, is part of the deal. He also really created the business model for large-scale addiction companies and was the first of the kind, and it's been replicated over and over again, including here at Promises. So this is our panel. These are my friends. They love recovery. They love the city of Nashville, and they've done some amazing work around really developing the continuum of care. And Carly gave me a couple questions to ask you guys about the continuum of care. Does anybody want to, you guys are the experts, anybody want to define the continuum of care or how you view it? What in the world are we talking about?
I'd like to jump in there and just talk about something in the continuum of care that I think that I'd like to hear from the panel talk about, and that's prevention. When I look at the continuum of care, a lot of people think about ASAM, the levels of care, right? Or the CPT codes that you're billing for that level of care that you're delivering. But what we don't talk about many times is prevention programs. And for me, that is just, it's sad, right? I love what you've done, right? To go out into Nashville and give needle exchanges out when people wouldn't even accept it or when it wasn't even legal is amazing. Right? And I felt that way 25 years ago, 30 years ago around dual diagnosis when I wanted to give people medications that were bipolar or schizophrenic that were coming off drugs and were being told at AA meetings and at treatment centers that you shouldn't do that. That's education. And where's the prevention and education going? My kids went to public high schools here locally in Nashville, and I think they had a half of a counselor for 2,000 students, right? And we all know that mental health and substance abuse starts, grade 4, 5, 6, where do you want to start it? And many times circles around mental health issues. And I really have to say, I was very disappointed at the amount of prevention that was being provided to my kids going to a public school in Tennessee. And so I hope that when we think about the continuum of care, it's not just detox, residential, PHP, IOP, sober living, that we can back up a little bit and go, how do we teach our kids and educate and give people the right knowledge, like this gentleman does, on so many different areas for kids that are growing up. So I just wanted to throw that out there before we got started to say, are you considering prevention as part of the continuum?
Absolutely, right? Absolutely. So it starts with prevention, and then there's that process of care. Something Dr. Loyd talks about quite a bit is the chronic model of addiction, the chronic care model. I don't know if you want to speak to that.
Yeah, I do, and I love what Michael said there. But addiction it's the only disease I've ever found that if you don't get better, it's your fault. And it's really amazing because I had plenty of diabetics that didn't get better and lost limbs and had heart attacks and continued to drink Mountain Dew Code Reds, and nobody ever blamed it on them. And an addiction is not like that at all. And we're going to send you away for this finite amount of time, and then you're going to come back and be okay. And I don't think that there could be more wrong with that. So it is the chronic disease model, because I know a few of us up here are in recovery right now. I don't think any of us consider ourselves cured. And I think all of us consider ourselves still somewhere along the line in the treatment process. And so I think that we have to change our mindset on what addiction treatment looks like. And what Michael said, and Sam, I'm going to give you my definition of continuum of care. It's meeting hurting people where they are and helping them find a path to recovery that's right for them, no matter what. That's it. And prevention is a part of that. People don't know this. We're a stone's throw away from Fall Hamilton Elementary School, right here where we are right now. Does anybody know what happens at Fall Hamilton Elementary? Right? All of us in the recovery community, we have no idea what happens right down the street. Fall Hamilton Elementary School is in one of the highest incarcerated zip codes in the United States. It is. Wow. And they have a completely trauma-based curriculum for their kids. And Thomas, I don't not knocking Narcan. I love Narcan. We ought to have it. I throw it on the street all the time. Narcan's not prevention. Narcan's bringing people back from the dead, and I'm good with that. But prevention is helping them not go down that path in the first place. And we know what some of these risk factors are, and we actually have some idea about how to address them. So Fall Hamilton's right here. I didn't know anything about it when I was with the state. My tendency is just to go and knock on the door. So I went and knocked on the door. Found out you can't just walk in elementary schools anymore. And the guy with the rubber glove was surprisingly gentle. But once I got in, all the teachers are trauma informed. And so these kids that they have coming from these households where we've got a pretty good idea of what it's like. Instead of being disciplined like I was back in East Tennessee, a victim of physical and sexual abuse and chaos, paddled, these kids are being redirected, and they are being taught different tools to handle these things that they're going through in their lives, and some of it we can't imagine. So I couldn't agree with Michael more that we always forget that part of it, and the truth is that's where there's more bang for the buck. So that's kind of my vision of it, and what I look at it as. I'm tired of seeing people turned away from recovery because of the path that they're on in their own journey. I think that's a shame.
Other thoughts on that? Trina.
You know, I can piggyback off of both of them, but I think when I think about prevention, when I think about the continuum of care, the reason our model is the way it is because I don't believe in short-term recovery. I believe that I am a byproduct of long-term recovery. And the reason that I'm still here as a long-term member in recovery is because it took me more than 30 days. It took me more than 60 days. And I believe the wraparound supportive services are key. And how do we prevent a person from coming back? We walk with them. We meet them where we are. You don't cookie cut everybody in the same system. And so I think that's why continuum care works. But one of the things that we have moved towards and hoping to bring more awareness to addiction, we started with women touched by addiction. You touch one woman, you touch one family, you touch one community, you touch one city, one state, one country, right? If we touch the woman, right? But what we're doing with that is not just about addiction. Because when we think about addiction, it's like you said, it's not just drugs and alcohol. We got some mental health disorder. We got that co-occurring model. Thank you for bringing us over the bridge, Michael, right? Thank you for bringing us over the bridge. But now, guess what? If we're really talking about prevention and awareness, we got to go back home. We got to go back to the table where our kids are going to school. It's fine that we're in here doing all this fancy stuff, but what are we taking back to the people who are really in the crisis? We know a friend who was in recovery. We might be able to call for some help. But do our kids know about this program? Do they know about this process? And if we're really going to do some prevention and awareness, we got to go back first to our own kitchen tables and quit bringing Uber Eats and Grubhub and allowing the kids to go in there on the game. And let's talk about some of this stuff that's really happening around here. And we want to prevent them about COVID. We're talking about that at the table every night. But we dare talk to them about, hey, there's some new Pop Rocks out. And we don't know if it got mixed up in the store or if your friend gave it to you for Halloween. Like, we got to go back to our old-time kitchen table and talk about, and ask the important questions, the hard questions. Have you ever smoked? Have you ever sipped? Did you get some of that punch when we had that party the other night? We're talking about real prevention now. And so that will help us in our long-term continuum of care. And we may stop seeing that age gap of at 18 to that 24, 34. We might can prevent some of those coming through and treat the ones that we have now. So.
Thanks.
Is it okay if we ask?
Please ask questions. Yes.
My name's Travis Thompson. I'm a private practice therapist in Murfreesboro. One thing that my wife and I do on this side is we work in the foster care system for foster parents. We end up getting the kids that no one else wants, typically teenagers, right? People typically only call us if nobody else wants them. And almost without fail, we have a kid, they have a drug use history, nobody wants them. But then we start digging more, and mama and daddy have been on it for a while, right? And so we're talking about prevention. I can't tell you how many kids have come through our house, and we sit down and they're like, well, DCS tells me if I smoke weed one more time, if I test positive one more time, I don't get to go home. And then we say, okay, so where are you getting it? Oh, my mom and dad have it at the house all the time, right? So if we're talking prevention, is there kind of any insight or push into that? Because I've seen it over and over and over, where kids, they age out of the system. Parents are, still using to this day. We launched an 18-year-old. She has no one, right? Because parents lost all rights and then left. So is there anything for those like kids or that DCS system at all? Because I've seen these kids just go off the rails so easy.
From an education and prevention standpoint, that is my problem. There's not enough funding in it. And where you can capture most of these kids is at school, right? Most children go to school, and that's where you can actually, in the home life, many times, look, my parents use drugs and alcohol. Like many people that come through the system or end up with a substance abuse problem have family members that are struggling. And that's why part of the continuum of care of sober living is so important, is because many times you can't go back to that. But again, I don't think there's enough funding out there in the system. We're putting all of it in treatment, and all I was trying to say is, can we share some of it for prevention and for long-term care? We don't put a lot of money into long-term care in the system. Most of it goes to detox and residential treatment. That's where the bulk of the dollars for our entire system goes to. And I think long-term care, what Trina's built over at Mending Hearts is incredible. And lots of companies around the country have built great sober living models, but many people need more than 30 days of treatment or 60 days of treatment. Just like kids need a lot more than just a little bit of education or a half-time counselor for 2,000 kids. We need a lot more help in the school system, in my opinion.
There's a program called, I think, Monroe Harding or something to that effect.
Yeah.
And so but that's not enough. But if we go back to the metro schools, and we can put some prevention in there, and even if the child had parents at home using, maybe if we can make some awareness in these metro schools, and we can take a panel like this in the metro schools to do some prevention and awareness, maybe that child could make an effect on the parent taking it back home. And so like it's one of the things that I think that this society has moved away from. We have to figure out how to break the generational curse. And we always think that it has to start from the top down, but it's our youth who are gonna have to take care of us later, so we may have to go into there first. Yep.
Yeah, absolutely. Some of you mentioned, go ahead.
It's not a question so much. Before I worked in private practice, so up until recently, I worked for a company called Stars Nashville, and they have counselors in the schools that try and do prevention, but you're right, the funding is not there. The therapists are paid poorly, they're also overworked. Stars is a great organization, they're doing the best they can with the funding they've got, but yeah, I agree that if we have more funding, they would be able to put more of those therapists in the schools. There could be therapists for crisis intervention and for prevention interventions. But it all comes down to money, unfortunately.
I want to speak at politicians for a second. Sorry.
Statement before she moved to his question, but just like the conversation me and Monica was just having a few minutes ago, even when you're dealing with these youth, and even in those schools, the conversation and the demographics got to look the same. Like the individuals that's in there counseling, it's different. And I ain't taking from nobody who done went and studied and they've read this book about addiction, but I'm talking about the individuals who got live and learned experience needs to be in those positions, because the people who we trying to reach gonna ask some questions. And when they ask you these questions, them answers is gonna be important. If they ask you, did you perform these behaviors? Did you do this? Or did you, and you say, and then you try to throw them off, then that's not the same experiences that these individuals have. So it's, these people end up they ain't just so much gotta look like them, but they gotta have those type of experience so it can be some shared lived experience. Cause then they, you know, like they say, what touch the heart, reaches the heart, right. That's what you'll get from those situations.
That's a good point. Trauma-informed lived experience can get them to go see the doctor. Yep. Sometimes it takes somebody that's been through it to be the shepherd, to get them to go somewhere to get some other help. I think that's where prevention will come in for the families. We'll have to teach the kids from a scholastic standpoint, because sometimes the parents have failed. And then what? Then what do you do?
Sam talked about it when he was introducing all of us, is that I love the recovery community here. We talked about it while we were up here eating. The opposite of addiction is not recovery. The opposite of addiction is community and relationship. And that's what we're talking about, and that's what you're talking about. If you're sitting there and all you've ever done is read out of a book, it's going to be pretty hard, because they're going to sniff that out in a hurry. I found that out the wrong. Yeah. It doesn't. Kids are the ultimate truth tellers, but and I'm not knocking politicians, although I am. If you look at what you're talking about, prevention, that's where the main bang for our buck is in prevention. I think $1 spent prevention is $11 downstream savings. There's nowhere else like that. But when funding becomes available and we start talking about prevention, it's all thrown into Narcan. And again, I've got Narcan all over me. I'm fine with it. But the reason for that is because you can show a change on a curve in a 2 or 4 year election cycle. Mm-hmm. We will not show a change in the curve on a 2 or 4 year election cycle, but we will change the needle in generations, which is what you know. You know that. And so I think we have to start looking at what we're measuring. And when you go into school here, I mean, they have a little video on YouTube. Just put in Fall Hamilton. It's 7 minutes long. It's amazing because what they're doing here has the potential to bend the curve down the road for generations. My son's sitting in here. Heath, my son's right back there. I can promise you this. I may have messed up in other ways. Heath is not carrying the baggage that I carried as a kid. And my guess is if he ever produces any grandchildren for me, no pressure, which I'm a little salty about right now, but it'll be markedly different than the way I grew up. And that's what we're talking about.
Do you want to talk about that trauma, Heath?
Yeah. I want to do it.
I'm here for you. So you guys mentioned trauma-informed and no wrong door. How do those two concepts work together, and how do we make a continuum of care trauma-informed? Carrie, you haven't answered the question.
Yeah.
You want to take that one?
Yeah, well, I think it's our responsibility for all of us to make sure that we do our due diligence with understanding trauma-informed care, and that in the organizations that we're working with, that we provide that for everyone else that's in our organization. Because we need to be able to sit down and talk with someone and understand what they need. That is our responsibility to them, to learn their story and what they need and help give them the best services that we possibly can. So when we come in with a cookie cutter approach, we are missing that opportunity to be able to hear from them where their wounded places are, where their strengths and resiliency lies, and help them really develop that. So I think that's one of our starting points, is making it a mandate for ourselves and for the people in our organization to have that training and to continue to build on those skill sets.
A couple of you said no wrong door. What do you mean by that?
The truth of the matter is, we have some wrong doors in our community. Mm-hmm. And if I don't look like you, smell like you, dress like you, 9 times out of 10, I can't get in your treatment program. And so if we're really talking about no wrong door and welcoming those who are suffering, then if I'm a female, if I fit the qualifications and I'm suffering from addiction and I'm in co-occurring, I should be able to meet you where you are. If I don't have the service, if I'm providing a 30-day treatment there's a couple of things that are going to kick me out. It's going to be my psychiatric disorder that disqualifies me the most. It might be a medical issue. But other than that, if we're talking about no wrong door, I should be able to walk through your door, or your door. And it doesn't matter if I'm black, gay, straight. It doesn't matter if I'm in the middle of going through a transgender change. And it doesn't matter if I got a Gooch or a pair of buddies on. I should be able to receive services. And if you have whether it's a quality of service for this person, it doesn't matter my income or my demographics, I should be able to get that service. And so one of the things we gotta shut the door on and reopen it to is don't put me in a house over here that is not remodeled because of my insurance. And you put me one over here that got the Betty Ford look. So if we're talking about no wrong door, I want to experience the quality of service that the other 30 patients are receiving. I want to see the best therapist in the house. I may be your therapist in 10 years if you give me the best therapist in the house. And so don't weaken my process because of my economic status or my demographics. And so we have a lot of that going on in our industry. And I know that for-profits, and I probably don't need to be saying this because I'm a nonprofit, but no, I can say this. I can say this. Yeah, you can say this, Trina. Listen. And it doesn't matter about nonprofit or for-profit. The only difference is a nonprofit, you get tax break and people from the community, you bring your tax dollars to help this community grow. That's the difference. It's everybody has to be paid for a service. But one of the things that we forget is we start going to get the sorority folks and we leave these other people down here. Yeah. And if I ain't got $10,000 to bring you in the door, quit saying you're in it for your heart. You're not in it for your heart. You're in it to make money. It's okay to make money. But let's treat the people for real if we're talking about a no wrong door. If we're all welcome, it's welcome. Maybe that was too much for this process. I'm sorry. No, I get that's my bandwagon. I apologize in advance.
I feel the same way. Look, I started a not-for-profit where Trina lives.
Yes.
Right? Helping men with schizophrenia and addiction, and I loved it, right? Because those clients couldn't get in any door. They couldn't get in any treatment center. If you had schizophrenia and addiction 25 years ago, forget about it. And we did accept everybody. But the challenge you run into is you start realizing that socioeconomically, there are programs set up that are plushier and nicer, and you got horses and you got all kinds of, chefs cooking your food, and you have programs like Mending Hearts. And I think what you're saying is you want to see all programs be similar, which I would love to see that. I wish we had Medicare and that's it. No other insurance plan. That's just my personal opinion. I don't want to get off on a political soapbox, but the fact that we have 1,000 insurance different companies making rules in 50 different states writing their insurance rules of how you operate, it is challenging to offer similar services to everybody. And I also wish that whether you're in a not-for-profit or for-profit or serving the Medicaid population or the high-end commercial private pay population, that we would treat people similarly.
Yeah.
Right, I really do believe that.
Dr.
And I've always
Loyd's
thought
gonna jump out of his chair.
But because I'm feeling some guilt and shame here. We got a therapist in the house, so we can work through that. I came out of a treatment program where I got 90 days of the highest quality care that you can get in the United States. Michael walked into 202. I know your story. Mm-hmm. Thomas, I don't know yours, but I had 5 years of aftercare and follow-up. I had a 6-figure income job waiting on me when I got home at my medical school. And I thought that's what everybody got. I did. And then when I came here and I met you and everybody else, and I'm looking around, and then my eyes were opened. And once your eyes are open, you can't close them anymore. Mm-hmm. And so I couldn't agree more. There's multiple treatment pathways in this country, but there's only a few of them that get what I got. And the reason I got what I got was because I was a doctor. and I cost too much to kick to the curb. Your tax dollars pay for my medical education. I'm expensive. And so it's better to recycle me than it is to kick me out. And that's got to change. Because if you look at the two most successful groups of treatment for any addictive disease in the United States by profession, you know what they are?
They're professionals.
Doctors and airline pilots. And you know why? Because they get high quality, long-term inpatient care, case management. It ain't a secret, right?
Long-term care.
It is long-term care.
Right.
So if you look at a doctor and airline pilot that walk into a treatment center on day one, what percentage of them at 5 years are back in their job and stable, providing an income and back in their lives? Anybody know?
90%.
It's about 95% every time it's been looked at. And if you look at the regular person, there's no way you're single digits. It's got to be single digits. And that's where we got to change. So I couldn't agree more.
You know what the third group is?
I'd be curious. No?
DC4. So DC4 has outcome results very similar to airline pilots and physicians because they follow that chronic care model, which is that continuum of care. The best predictor for outcomes is not how long you did residential, it's how long you stay connected to services.
Right.
Well, and I think
That's
the other
my
piece.
story.
That's my story.
You want to say more about DC4? Because I don't know that everybody knows what DC4 is.
What DC4 stands for, Davidson County Drug Court, and it's a drug court inpatient treatment facility that Judge Norman started years ago, who's now retired. And before I heard about the treatment facility, I had a brother that went to the treatment facility. And when I was incarcerated, my brother told me, he said, man, you should go to this treatment facility. Because I had a drug problem, not just because he felt sorry for me, because as a brother, because I was getting on his nerves, you know what I'm saying? So he told me I should go to drug court. And so, like, in drug court, there's 3 different phases, and it is the best thing that ever happened to me, and the best thing that I think could happen to any human being who go through it, because it was the first time that I ever, because drug court is a furlough from jail to this facility. They can't, the judge can't make you go to drug court. It's got to be you took an option and said, I want to go to drug court. So they furlough you from jail to this treatment facility. But the treatment facility is in these phases. And then when you get to this 3rd phase of the program, besides all this inpatient stuff that they end up having you to do, to start talking about all the stuff that you done went through in your life, the sexual abuse, relationship abuse, what your mother didn't do, daddy, all of those stuff right there. They take you through all that. They take you through steps. And then the 3rd phase, which was super important to me, because every time I got out of jail, I got out of jail without a job. I got out of jail and went back to where I've always went to. I hung around who I always hung around with, especially the people who I was incarcerated with, switching stories, telling lies about while I was in there. And I started hanging around them and end up doing the same thing. Well, their 3rd phase is that you start working a job and then you be on this job 4 to 5 months before they let you on the streets, which the best thing could happen to any human being because you already built a relationship with an employer. So then after you leave there, 2 years after that, you still going back and forth to drug tests, outpatient classes, and then they got a whole lot of other things that they got you doing to keep you. It depends on who you are. That they, just like Trina said, it also depends on who you are, because everybody don't get to do those things. And a couple of other things they end up doing is they start bringing people from different places. Because even though it's called Davidson County Drug Court, today Davidson County doesn't fulfill that place. People from outside of Davidson County, it's 90% of that program now. So they really losing what Judge Norman started, but it's being ran by somebody else. But it's the best thing that ever happened to me. And I think it's the best thing that anybody could possibly do. It is truly long-term treatment, you know.
It's a great program.
Well, I think the continuum of care, we're talking about quality of life for people. And so to expect someone to be able to get their life back in line in 30 days is a setup to fail. So to be able, when I look at the people we've been able to keep for a year or more, you know, they're still working jobs that are usually part-time jobs. They're going to meetings. They're building their relationship back with their family. And that's a success, and that's what they can manage. To expect them before then to be able to have full-time jobs, go to meetings, be involved in the recovery community, take care of their mental health, all within 30 days, 60, 90 days, it's ridiculous. We don't expect that of anybody else. We don't expect anybody else to rebuild their entire life in 30 days and be a productive member of society. Right. So this is also looking at the quality of life that we want for people, and to make that a value that we have, and then we extend it to them by providing the services that they need, the support that they need, the long-term housing or whatever it is, job connections, support networks that they need, so that they don't have to try to figure it out on their own, and that they feel that support.
Great example.
Sam, it's funny, Thomas said that part of my awakening process was that. I got in recovery here in Nashville. I went to a place out at Grassmere, CPE. A guy named Chip Dodd turned my life around and saved my life. I love him. At any rate, we go to outside meetings, and these white buses that keep pulling up with all these people piling out of them. And so I sat next to him in the meetings out in Bellevue and all the places we were, and I kept asking, he says, "Where are you from?" I said, "I'm from DC4. And I was like, "What in the hell is DC4? So the weird thing was, back then, we couldn't go home on the weekend, but we had cars. So I drove out there. And that's where I learned about this, where I met Judge Norman. And it's amazing. You watch the success rate, because I get beat up. Sam and I did not get in an argument on the front page of the New York Times. They took both of us and put us against each other, and that's not fair, okay? But it does read that way if you read it. But my point there is that if we had access to what we're talking about up here, nobody'd be talking about medication. It'd be this many people, right? And there's some that's going to need it. It'd be this many. Right, and so we have to make a commitment to sticking with people over the long haul. DC4 works. It's financially. If you don't care about anything else, it saves money. Right? I had a patient that I told Walmart they should pay for his treatment because, hell, he's taken way more out of there than they ever had to pay in treatment once he got into recovery, right? And so I think this is the thing that I don't hear people talking about a lot, because we want to take medication, the things that I make available, because it's the easiest way to get to the masses. And I think we miss the opportunity to address these things that are underlying. They're really going to help them change their life.
Where do you plug in technology? Right. One of the benefits from COVID, which has been a brutal year, but one of the things that we're starting to see now is people will engage you at home. And, a lot of people don't want to go to treatment. Like when they call a call center, they call you up needing help, and you tell them you got to go away for 30 days, or, you got to leave, or you got to quit. A lot of people want to reduce their use, not quit, right? You start that conversation, they're in a pre-contemplation mindset, and you're ready to throw them straight into action. You're ready to take them straight to treatment. I think part of the continuum of care is that telemedicine. Really meeting people where they are, and how do we utilize that as treatment providers to reach more people where they are in their homes, where they want to be, and how do we deliver that care to them? And where would that fall in the continuum if we treat people at home through that device?
And one of the benefits of that device, I'm glad you brought that up, because when COVID hit, Heath had to teach me how to use Zoom.
I know, right?
I didn't know what it was.
I have a son probably about his age as well. And he get the same instructions.
He got really frustrated with me too. But now we're in people's homes. And that was the thing I didn't realize, because I'd hear, I'd see them when they come in the office and they put on this face for 15, 20 minutes. Mm-hmm. But now I'm in their houses and I can look at the chaos going on in the background. Or, I made this mistake so many times. COVID, we watch people go from living in homes and rented homes to living in apartments, hotel rooms, and in the street in their cars. And I watched that. I wouldn't have known it otherwise. The first one, and this is terrible, but he had a job at B&A. He was over the thermostats. Good job. And when I saw him be a telehealth, he was in his car. His kids were in the back seat on their iPads. By the way, they were in school. Mm-hmm. And I jokingly said, "Hey, man, you living in your car?" And you know what the answer was. Mm. "Yes, Steve, we are. I lost my job. And we live in here Monday through Thursday, and we get a hotel room Friday, Saturday, and Sunday. We get cleaned up, and then we do it again next week." So I agree with Michael. It allows us to see where they are, but now we can start looking at those social determinants of health, because that's what's going to move the needle. Access to me and all the stuff we do, that's 5%. Trina, way more than that because of all the other stuff, but that's 5%. Now we can start looking at that.
Yeah.
Yeah. Well, so going back to the no wrong door piece, how do you get somebody to go through a door? And does it matter which door they go through? Thomas, you put more people in treatment through streetworks. And
Yeah, I don't think it matters what door that any individual go through. I do know that when I even think about no wrong door, I just think about options and everything that an individual could possibly need depending on what situation they is. And I'm talking about everything. I'm talking about from shoes on a person's feet to a haircut to something to eat to help them get medication filled to bus passes. I'm talking about they could possibly need anything. Like when I think about my father's house is a direct result of just watching Trina run Mending hards and sitting with Sam thinking about, because Sam asked me for 2 years after my sponsor died, what was I gonna do and what was I gonna ever work for myself? And man, you talking about, and I'm telling you talking about a guy who had 4 child support orders. I owed back pay child support. I had 4 kids prior to even getting clean. And I couldn't even, every time he asked me that question, I say, man, I ain't even thinking about working for myself. And these people ain't waiting for me to pay this child support and stuff like that because what I do know is that society treat men different than they treat women. Yeah, they'll hold a program for 2 years for a woman to go to, but let me talk about I want to lay down for 2 years and let me get myself together. No, they won't do that. You better get up and get a job. You better, and pay these bills. So like when I think about an individual that need to go through any door, I just think about what this individual will really truly need. Like and it's basically based me listening to this individual in front of me talk about, because I don't never really know what they need. I do believe in a harm reduction approach. Like I believe in Narcotics Anonymous my whole life. I owe my life to Narcotics Anonymous, nor do I promote it or push it on any individual. You know what I'm saying? So I believe in whatever this individual tell me they need and try to figure out which door, what group of individuals or who I can connect them with to get some of those things off their chest, you know what I'm saying? Because I really never know what's important to an individual, because I know when I go to the barbershop, I get out the barbershop chair, I feel different about myself. I know when I go to the store and I put on some different type of shoes, I feel different about myself. And I know other individuals when they get out of jail or when they homeless, I can watch other people's faces and demeanor change when I give them, like even when I was giving out snacks through the back door at Streetworks and giving a person a Pop-Tart, a bottle of water, and a bag of peanuts. They felt different about themselves. When I gave them, when a person took a free HIV test or a hepatitis C test, and I gave them a free haircut barbershop coupon to individuals that I build relationships for them, they feel different about themselves. When I took the mobile vehicle to the homeless population and we hooked up clippers with a couple of barbers and they cut their hair, I watch them jump off the truck like that haircut changed their life. You know what I'm saying? So I just know that that's not possible to be a wrong door. I just need to figure out who I'm talking to, the audience that I'm talking to, and figure out what it is that they need. And I believe following up with people is so key. Like it's different to tell somebody to go over there, they doing this. So my process has always been, let me take this person over there and show them that they doing this. Because what if they get over there and that's not really going on and I sent them there? It seemed like that I just pushed them on away. I just passed the buck. And I don't really believe in passing the buck, you know what I'm saying? And then you got to have people on the ground that can do that, because some people's lives get too busy that they can't do that. But that's why you have other individuals that you put in place that can do that. Then, that feel the way they feel, that you can feel it in your heart what they feel like that. Because if they had an option to not do what they doing, they wouldn't be doing what they doing. So my conversation shouldn't be saying, oh, I know how you feel. Now, man, that ain't what you should add to their conversation. You know what I'm saying? You just should be trying to figure out what can you do to help them and walk them through that. So that's what it looked like to me.
Well, figure out where they're at. I mean, first you got to figure out, is somebody even wanting treatment, right? They just may want to be out of trouble, right? They want to get their marriage back together. They want to get people off their back. They want to get their boss off their back. So first I try to figure out where somebody's coming from. Now, if they're in action and they actually want to come through the door, that's what can be discouraging, is when we have exclusion criteria, right? You can't come here because you take medications, or you can't come here because you don't take medications. You can't come here because you look this way.
You're pregnant. Can't come here because you're pregnant.
Right.
Or go get clean
never
first and then come back.
Them out because they use.
Yeah, and now they do it. Now treatment is so different now that if you ain't using a specific substance, it's almost difficult for a person to get in treatment. I've called people, and the first thing they asked me, which was crazy, I think it's disrespectful for you to ask me what are they using? A drug? That's all I should be able to tell you, that they on drugs. Now you can tell somebody they're using crack, and then they talking about call them back because they more focused on trying to fight this opiate addiction. Right. So they getting funds for this opiate. So if you ain't using that, get back with us. Now we ain't got no beds. They don't even answer the phone for you no more. Those are the type of situations that they facing today.
I'm getting the 10-minute hook. Questions from the audience, comments from the audience. You're a lot of experts sitting out here as well.
I got a comment. Y'all need to go to high schools and talk. Seriously.
Really, you should.
Y'all know I'm
That was one of the best things I did as a prevention thing when I worked for STARS. Was I was out in Cheatham County and I had Patrick. I always mess with his last name. Custer, whatever. Thank you. I had him come out and tell his story. And there were several kids that came up afterwards, and some kids were jerks and laughed and, teenagers. But there were like 5, 6 that came up afterwards and said, my family's been affected by addiction, or I'm struggling with addiction, and it was really powerful. So if you guys can connect with STARS or another organ like any of the schools, I'm sure they would love to.
They won't read emails. You got to text them.
You've inspired me to do that, though. I will. My wife actually did her internship at STARS. I haven't thought about STARS in a while. My wife did her internship there many, many years ago. And we've always talked about prevention and the lack of it in schools. So I appreciate
the whole continuum of care, and you all explained exactly the same stuff that could be put into a level where people could understand it. I can hear Trina and Dr. Loyd say stuff. They say the same thing, say it differently. We're trying to get to the same place. A lot of those people, kids, not just kids, the staff, can benefit from y'all having this open conversation with them and the students at the same time. Because you look like a whole school, not just a school. You look like everybody. Much respect for you guys. I work with all y'all in some capacity. Now you too. So you guys are awesome.
I have just more of a comment, but specifically, my big heart in the long run is to open a treatment facility in Rutherford County Jail. Doing, like, my whole life is centered education, all of that. So seeing a lot of the stuff that you've said is, as I'm getting my foot in, it's crazy. And on the financial aspect, doing the research that I think it was 2013 they published in Pennsylvania, if they could lower recidivism for drug use by 10%, with all of the services that are involved, police, treatment, jailing, you could save $635 million. Which is crazy, but that's the population nobody wants to touch.
This is a journal article I wrote, right? So I'll just quote myself. Is that okay? Is that okay? So, 10 years ago, what do you think it costs for a day at DC4? Any guesses? $61. Any guesses on how much it costs to incarcerate somebody in the state of Tennessee?
127.
It is now 100. What's that?
Is it? I thought it was in the 70s.
It's $127 now. It was $89 then. You save $30. Doesn't matter if anybody did anything, right? You start multiplying that out by 120 beds. You start multiplying that out by 10 years, 20 years. You start multiplying that out, that we save $10 million, right? You start multiplying that out by people didn't come back, $50 million, right? You start multiplying that out by people didn't come back, people didn't get reincarcerated, it was $200 million. You know what they did? They built another treatment center in Wartsburg, right? Because the back of the napkin that we took to Governor Haslam said, oh, we saved a bunch of money. It wasn't, we saved a bunch of lives. It wasn't a bunch of dads came back and engaged themselves in their children's lives. It was not a bunch of people worked. It was, oh, we saved money. And they just went with the simple one, right? They didn't go with the $300 million. They went with we saved $30 million. Boom, done, right? But the issue was trying to get the Department of Corrections and the Department of Mental Health together. And then when they put them together and said, this doesn't come out of your budget or your budget, this just comes out of a new budget, then they were able to do that. So, I mean, there are all sorts of barriers to those things. So.
I had a night in the Rutherford County Jail. That sounded terrible.
I had a couple.
I would have when I was younger, but I did a program in there one night, and I had the men on one side and the women on the other, and there was a big divider, and I was at the front of the room, and I was talking about drug-dependent babies. And this is not a population I'm used to being around. I mean, flames coming up the necks and ear gauges, and and I'm sitting there, looking around like this is not, I was uncomfortable. And but when I got into it and I started talking about addiction, and I started to talk about these babies, and then what we could do, I looked up and I saw a bunch of tops of heads, and I saw a bunch of people consoling each other, and it was really my eyes got, my eyes have been open so many times, but that night, just in particular, this was a population where, I'll be honest, before I started doing what I do now, if I was walking down the street, I would have got over to the other side of the street. It's just the way it was. And now I'm in there and I'm watching them. And one young woman raised her hand and she said, Dr. Loyd, she said, because my baby was born dependent, does that mean my baby's going to grow up to be an addict? And I got to give her a great answer on that one. I said, absolutely not. That's one part of it. The environment that we can raise the child in now, and it starts with decisions you make right now, right? And so I think that because I always thought the people who went to jail were just all bad people and they need to be there, and then they should be there as long as possible. That's what I thought. And then I started looking at it, and it's designed to keep them in there. And I've been so frustrated with that. I've seen folks violated for things that I just can't believe happens, but it happens every day. And so I think we got to look at what you're talking about, Sam. And if we can, most people in jail, 55 or 60% of them are in there as a result of a nonviolent offense related to substances of some type. And but the other thing I learned is it's also a big place to employ people in rural areas. And so if you're going to have jails, you got to have people put in them. And so I've learned that reality too. So sorry, that night made an impression on me. It still does.
Final thoughts?
I think he had one more, right?
Oh, I'm sorry.
I just loving having this conversation, so I come up with something.
I think it goes back to the beginning when you said, how do we work together? And Nashville does work together, and I believe that. Like, I've worked with Trina forever, worked with a lot of folks in the community for a long time. There's some new programs, new agencies. Would love to see a list put together. Who came? What are we doing? What are we doing differently? How do we refer to each other? I'm sure that Promises, who put this on, thank you for a beautiful lunch, wants at least one or two referrals for the lunch.
Yeah.
But how do we work together? Like, how do we treat different people and not have a wrong door? Like, can Trina treat people that you're not treating, or vice versa? And there's new players, new agencies, whether it be NRC or PRC. I'd love to know more about it. And how do you send somebody there? And what type of patients are you looking for, and things like that. So any information y'all can put out there to let us know what's going on in the community and what other programs like STARS may be around that I'm not even aware of right now.
Sam, I'm going to close with the Jewish Rabbi Hillel from about the year 1200, and I am not a scholar in any way, shape, or form, but I love his quote. He said, "Love your neighbor as yourself." The rest of the Bible is just commentary.
Wow.
I'll go with that.
It's a good place to end. And you talked about connection earlier as being the antidote for addiction. I think connection throughout the recovery movement and the recovery treatment field is really the antidote to addiction as well.
I was thinking about sitting here right now. I'm actually giddy. And it is. I mean, it's a connection. Oxytocin's released in our brains, and we're having fun sitting here talking to each other. And so that's what we're talking about.
Yeah. Love you guys. Thank you.
Thank you.
Appreciate you guys coming. Appreciate you guys participating. And hope you guys all enjoy your lunch. And grab a T-shirt and whatever else up front, and we'll go from there. Is that good enough, Carly? Yeah.